send a trailer out there. We're talking about sexual behaviors today. And this topic is very important to me because it has its social and religious connotations. The way we look at sexual behavior in our social setup dovetails with people's beliefs. There are people out there who think sex, even talking about sex on its own, is a sin. It's a no-go area. But sex is part of our lives. We are all in this world because of sex. We can't just run from it. Yes, as I wrote yesterday, I was talking about Abraham Maslow. I was talking about Maslow. Maslow has a hierarchy of needs, and the base of his pyramid is psychological needs. And among our psychological needs are food, breathing, water, sex. You can see sex is very important. Sleep, erection, and something called homeostasis. Homeostasis is the balance that you have between yourself and nature. So when people are denied of food, when denied of water, when they're denied of sex, when denied of sleep, if you're sleep deprived, you know how you become a walking track. When you're denied of erection, then the homeostasis balance is not there. And once you lose your balance, you lose your reasoning. So sex is incorporated, much as it's not talked about much. What do you call it? Discussions, or mental discussions. Once you live with people with mental health, you get to know that a time comes that they get that urge. That sexual arousement comes out, arousal. They get sexually aroused. And we just allow them to do what they have to do. It's very interesting. Today we're going to talk about Bill. Bill is found masturbating every morning in the common area. That's the difference. The balance, he doesn't know where to have his privacy. So in the common area, dining hall, anywhere, you saw Bill, excuse me to say, playing with his manhood. All right, so what is the approach? We're going to ask do and don't. So, yell at him to stop.
Don't.
Why don't you yell at him to stop? Can you explain?
Because he doesn't know.
Exactly. Somebody said he doesn't know. He doesn't have that balance of thought as to know what he's doing is right or wrong. That's why I captioned my topic for the day, sexual behaviors in mental health. This has nothing to do with your religious belief or your social beliefs or whatever. I'm talking from the mental health perspective. And by Maslow's hierarchy of needs, sex is part of our psychological needs. And you can't deny the person. Once you deny the person of that need, then the homeostasis, the balance that he has in the brain, tilts. It's not balanced. The person will not have balance of thought. So, you don't yell at Bill to stop. Okay? You can explain to him that this is inappropriate. Yes or no?
Yes.
No. Explaining to Bill will not solve the problem. If you tell Bill don't jack off in public, well, much as you're doing a good job, in your sense, you're denying Bill of his psychological needs. Okay. Restrain his arms so that he doesn't jack off.
Don't.
Yeah, you don't restrain him. That is his psychological need. He needs it to get that balance here in the brains. Make him feel upset so that next time he doesn't have to do it. You can just shake him off or tap his hand or something that will make him angry to distract him from doing what he's doing. Don't. Yes. So what do you have to do? Do you have to take him to his room, close the door, and give him privacy?
Do.
Exactly. When you see a mental health patient masturbating and you are disturbed, please give them privacy. Take them to their private room. Let them have whatever they want to have. Let them enjoy themselves. Okay? And when they are done, yeah, God will thank you for helping His creation. Offer an activity to occupy His hands and mind, like sorting out screws, washers, or folding clothes, or...
Do.
Very good. So I told you recreation. Sex is part of recreation. So if you are not comfortable seeing Bill touching himself in public, then get him something to do. Get him some brain teasers to do, okay? Get him some music activity, or let him sort out screws, okay? So I think we'll end here. That is sexual behaviors. Okay, there's another one. James approaches female residents and attempts to grope them as they pass by. Do you have to explain that his actions are inappropriate?
Don't.
Honestly, yeah, there's nothing wrong explaining to him, but it doesn't make any point, right? To him. Very good. You have to get angry with him so that next time he knows what he's doing is not right.
Don't.
Yeah, they are groping female stuff, but you don't have to be angry.